Now let me turn it over to the ranking member, Gillibrand, for her opening statement.
Thank you, Chairman Scott, for calling today's hearing. I really appreciate it. Thank you for our witnesses for being here today. Combating drug shortages and supporting high-quality generic drug production is one of the most important issues facing Congress today. In 2023, I heard from countless New York constituents who struggled with access to chemotherapy treatment due to shortages of essential generic cancer drugs, including cisplatin and carboplatin. I don't know if I said those right. When you are fighting a disease as devastating as cancer, the last thing you want to worry about is whether the life-saving drug that you need is available. Another issue that's extremely concerning is the quality of generic drugs, especially those that we import from overseas. I've heard time and time again that the difficulties the FDA foreign inspectors face when they are inspecting these foreign facilities. This can include basic logistical support or a third-party translator. When an inspector is abroad for months in a place where they may not speak the language, it can be very disheartening. Inspectors can also be put in a position where they must recommend the closure of a facility, but this can have a cascading effect of domestic generic shortages. The FDA needs adequate funding and support from Congress to ensure that they can not only conduct these inspections, but also enforce violations to protect the health and safety of the American public. We also need to work on solutions that promote transparency and quality benchmarks in the generic drug supply chain. The pharmaceutical supply chain can be very long and opaque, where several countries and companies are manufacturing various ingredients at various levels of quality. Purchasers need to be incentivized to purchase high-quality drugs that have proven reliability and a proven reliable supply chain. Hospital and practitioners are spending millions of dollars a year due to drug shortages. Ultimately, it's the health and safety of our patients and our constituents that are being put at risk. I'm looking forward to working on bipartisan solutions to promote safe and reliable supply chains for generic drugs. Thank you, Mr. Chairman.
Thank you.